which is obviously there's been some releases in the press about the results of a new trial that was presented this week. There's been the European Congress on the study of obesity, and some great and interesting research presented there. And the SURMOUNT-5 trial is a type of trial where people were randomized into two groups. So these were people that were looking to use weight loss medication to lose weight, and people were either given Mounjaro, which contains the active drug tirzepatide, or they were given Wegovy, which contains the active drug semaglutide, and they compared the results. And what they saw from this study is the patients who were taking Mounjaro and who were taking which is the drug tirzepatide, they lost on average more weight than those taking Wegovy. So the trial was over 72 weeks, so that's like a year and a bit, a year and 20 weeks. And the patients that took Mounjaro lost up to about 20% of their starting body weight, whereas those taking Wegovy, the results on average were about 13%. So both of those are still significant amounts of weight, but in this study, that level of difference between the two shows a statistical difference, which is what we talk about. When we look at trial data, that it wasn't just a spurious an observation. It was actually, there was a statistical difference. So we're seeing a little bit more weight loss with Mounjaro than we were with Wegovy. So obviously these were all patients who were either overweight or obese, so with that BMI of 27 and above, and they didn't have pre-diabetes in this trial. So that's the specific subtype of patients that were given this medication. So they also demonstrated that waist circumference decreased a bit more with Mounjaro than Wegovy as well. So some really positive findings there for the use of these medications in weight management.